Joining us now for the latest on the outbreak and possible treatments is CBS News medical contributor Dr. David Agus. He joins us from Los Angeles. David, good morning.
Morning, Dana.
Let me start with that idea of the drugs that we have heard about, chloroquine specifically, this anti-malarial drug. We've heard there's anecdotal evidence that it may work. For those of us who aren't doctors, what does that mean?
So remember, there's chloroquine and there's hydroxychloroquine, which is a much safer version. So hydroxychloroquine is on the market. It was FDA approved over the last 30 years for both arthritis and malaria and autoimmune diseases. And there is real data that it works. It's not randomized controlled trials, but individual patients' viral load has come down, and the mechanism in the test tube seems to be similar. And so because of that, doctors are using it across the country because we can write a prescription for it. We call it off-label use. You'll see announced early next week is there'll be a national database following patients on these drugs and their response to the thing. So we can actually collect data that Dr. Fauci was referring to.
But doctor, if you're writing prescriptions for those drugs right now, how do you know the dosage is right?
It's a great question. We're using drug dosages that others have used, both in Asia and here. I've probably written several dozen. I have several dozen patients who are on it. The biggest problem we face is that in California now, it takes about a week to get a test result back. And with these drugs, the earlier you treat, the better the outcome. So I'm many times treating before the result comes back because I want to get the best outcome for the patient.
Doctor, as people are obviously concerned with drugs that may work, also concerned with testing, where do we stand now in this idea that so many people want to be able to get tested if they feel the need is there?
We're not close in the testing infrastructure in this country, unfortunately. At major centers, New York's, LA, San Francisco's, there are long, long lines. We're still restricted in California to testing people who are symptomatic or who will make a clinical change. That this doctor will make a decision based on the result. We are not testing everybody. We don't have that infrastructure. And again, it takes days to get a test result back. So we now are having more tests. The problem is the infrastructure to run the test wasn't there and is trying to be built up.
Doctor, on the shortages taking place right now, ventilators and masks, heard from a nurse in an ICU yesterday. She says she's been given one N95 mask, expected to use that all day long. Of course, doctors and nurses have to eat and drink during their shifts, and then put it back in a paper bag and use it again the next day. How big a deal is the shortage of masks? How confident are you we can get more of them? How confident are you we can get more ventilators?
Listen, all of those are horrible. I went to the hospital yesterday and I walked by at least 20 cars with doctors sleeping in the cars. They're family members and they didn't want to infect their family members, and so they're not going home at night. They're sleeping in their cars every night because they know they're going to get infected and they don't want to spread it to others. We don't have supplies on the front line. We don't have ventilators. Respiratory technicians, those are the ones who run the ventilators. They're also starting to get the virus. And if we have nobody to run the ventilators, it doesn't matter how many we have. This is a war, and we're missing the supplies we need in this war. We sorely need resources at the front lines, and we need to start to giving drugs to people on the front line who've been exposed. It's called post-exposure prophylaxis. If you give a drug right after they've been exposed with HIV or influenza, you can actually block the virus. The hope is we can do the same thing here so doctors and nurses and other health professionals on the front line aren't going down.
There certainly are people who have been exposed and show no symptoms. These asymptomatic people, how likely is it that they are also then giving the disease to other people and may never show any symptoms?
It's one of the biggest issues with this virus is that people can spread the disease when they're asymptomatic. We don't exactly know how long. There's no test for infectiousness, if you will. And so the disease is spreading, and unknowingly someone can have it for a couple of days, go somewhere and spread it, which is why social distancing, staying at home in the state of California, we're not leaving the house. And that is the way to stop it. And, you know, the interesting part is that it takes 7 to 10 days after implementation of these drastic measures to see the benefits. So this happened midweek. The hope is toward the end of next week, we start to see a significant decline in the number of cases. I'm hopeful America is stepping up. We are all doing the right thing, and we will see the benefits. Combine that with the drugs that we're now using, and I think we're going to see a shift going from defense to offense against this virus.
All right, Dr. David Agus, thank you very much for your expertise. Appreciate it.